Hi, my name is Divya Dar, and I'm CEO of Seratis. Meet Lane Reddick, our CTO. As you can see, he's twice my size, and so we bring very different perspectives to the team. When my uncle became a doctor, more than 30 years ago, he was given a pager to help him communicate with his team. When I became a doctor 4 years ago, I was given the same bloody thing. Do you know what it feels like to be using a pager in the 21st century? Out with the pager, in with Seratis. Now, I walk into my evening shift in the ward, and my nurse approaches me to tell me my patient, Derek Aldridge, has got abdominal pain. I'm wondering if this pain is old or new, and if the daytime team knows about it. I log into Seratis, and what I see is no unread messages. I simply swipe over to see all my patients that are currently on my list, and these have just rolled over from yesterday. Now I want to add a new patient. I select Derek Aldridge, and voila, he's on my current patient list. I want to see his actual care team. So what I see now is Derek Aldridge and him in the middle with all his care providers around him. This screen is dynamic. What that means is you're able to see who's on Derek's team right now, currently. This means anytime someone changes shift, their circle gets removed and the other person's gets put in. You can also see colored dots which indicate presence, which means if you're available or busy. But for now, I'm very interested to know if Derek Aldridge himself has got this abdominal pain and if it was old or new. So I click on the patient's icon in the middle of the screen, and I see a bunch of messages. These messages have been there, and I don't even need to be a direct recipient of these messages, which means I can view real-time communication that has happened prior to my shift starting. Now, you can also see colors indicating the priority of these messages. I see that there's a message called abdominal pain. I click on it, and what I see is a thread chat message between the various doctors earlier in the day. Now I know just what to do. I go back to the patient-centric screen, and I see that I can start a consultation with a surgical on-call resident. I want to review at high-level priority, and I simply just send that message. Now I can carry on with the rest of my day, whether that is to go and get a CT scan for another patient, get some bloods, chart some pain relief. In the meantime, I've already got a message back. So what you see now is the ability for us to see if this message was read and that it's been responded to. I'm going to remember to mark this as unread so I can follow up with this doctor later. Seratis does enable you to integrate with the EMR so you can get real-time results on labs and radiology right to your fingertips. We also enable patients and their family to come onto the platform so that there's real patient engagement. We enable analytics so that we can track words like infection coming from Ward 8 and enable early containment. We are launching today. We're open for business, so if you're a doctor or part of the healthcare industry, come find us. Out with the pager, in with Seratis. Thank you.
Okay, great. Thank you very much. LA, why don't we start with you today?
Sure. Do you see this as a full-fledged replacement for pagers?
Yes.
How big a market